Thank you so much, Teresa, and all of you, Dr. Brower and Joan, and all the team members, the board members who have been dedicating all the energy and gifts that God has given you to continue the work of extending Jesus Healing Ministry through Faith Community Nursing. And I count a privilege to be part of this community of passionate nurses who have a heart for ministry. And it's nice to see all of you. A blessed and happy new year to everyone. And I was very excited to hear the announcements early that Dr. Brower was mentioning about CEs and opportunities. And I just wanted to, once again, say how much I appreciate the leadership of Angie and how she's taken this organization and health ministries in the NAD to another level and extending so many opportunities and online access to training for so many of you, especially the nurses. Having CEOs is a wonderful thing, isn't it? And you can access those wonderful trainings and still get credit for your profession. So anyway, I'm thrilled to be able to share with you today on an issue and a topic that I think is very relevant. As Teresa and I were discussing it, we thought that maybe this would be something that would be helpful. I think all of us who are in some way connected to nursing or faith community nursing or professionally working in this area of health during this pandemic year, we have been more than ever aware of how much misinformation and disinformation is out there. And what are we to do? How can we sort the facts from fiction? And so in today's presentation, because of time, we're not going to have a whole lot of time to discuss all the many myths and fictions and facts surrounding COVID or the pandemic. But I think what I really would like to share with you are principles that we can use that can guide us when we find information to find out, is this fact, is this fiction, is it something that I should promote, I should teach, or is it not? So that we have kind of like a foundation in regards to assessing and evaluating information so that we are better prepared to choose things that are more reliable and that can be more helpful to the members, the church members that we serve, the community that we serve. And maybe we can then talk about some specifics when we get to the end of the principles and really give some examples and answer some questions that you may have. So let me see if I can share my screen now. And good, I think you're seeing my screen, right? Very good. So again, sorting facts from fiction. I think one of the things that struck really was something that I was very concerned with from the beginning, and I don't know about you, but is how much information was being shared via social media, via all sorts of ways that will come to us, and then we would see, okay, is this true? Is it not? During a pandemic such as this, a new virus, there's so much unknown. And so as we started to be bombarded with information, there were all kinds of claims. And what are we to do with that? How can we sort through? I read an article just that was published in JAMA, which is a prestigious journal, the Journal of American Medical Association, in December 30. And this guy, doctor, Brian Southwell, developed a course at Duke University for clinicians, particularly physicians, trying to help their patients to sort through misinformation and disinformation during this pandemic. And I was very interested to see, it was an interview, and he was sharing some of what would be some things that we could do and trying to understand why is it that it's so easy for people to believe, to fall for misinformation in regards to health. And later on, if you have time, I can share with you the link of the article and just look for the title of it. Is again published on December 30 in the JAMA article, but journal. But one of the things that I thought was interesting, just to give some perspective, so we see in order for us to understand, misinformation is when we see a very much intentional effort of people to share information with questionable authors, oftentimes without a source, through social media or through media in various forms. And this information is a type of misinformation, which is actually really unethical. It's actually when people use misinformation to deceive people and to pass an idea that actually is not true, and do it intentionally. And so we have seen a lot of that during this time. And I think that it's helpful for us to, again, take a look back to what do we as a church believe, and what are the steps that we take, let's say a decision tree that we use in order to be able to identify this kind of disinformation, of misinformation, so that we can then help those that we serve, whether they're church members, whether they are, church leaders that don't have a background on health. And this is one of our roles as faith communities. In fact, it's important for us to think about what is our role, both as a faith community nurse or in health ministries during this time. And from the beginning, when we started Faith Community Nursing in the Adventist Church, it has been always in our mind that one of the roles is to reclaim the healing role of a faith community as we integrate health principles and standards and practice within the context of faith. And this has been a hallmark of Adventist faith community nursing from the beginning, as we initiated it, particularly in the NAD where it started. And so now with this pandemic, how can we do that? And I think I'd like to go back to Ellen White and what she wrote many years ago when she was talking about health ministries in general. And she was very firm to say that it was our role to educate. I mean, she really enforced this, and to do it pleasantly, without judging people, without making them feel ashamed, for what they believe or for their behaviors, and do it also intelligently. And I always like to say that this intelligently means that we do it in a way that really we're using common sense without extreme views, and using evidence-based information. And so this education that is a major role, I think, is really real right now during this pandemic. And so I think part of what we really should be doing during this time is educating people both on prevention, and in the context of COVID is prevention of the disease, as well as treatments and efficacious ways to treat and stop spread, but also share resources that are reliable in regards to prevention and treatment. And I hope to give some principles that we can be better prepared to do this kind of education in this way. I read a book in the beginning of the pandemic, really looking back at the 1918 pandemic. And I learned a lot about the processes that took that place then. And then we could draw some lessons now. But one of the things that I thought was very interesting is how science and the scientific method, even medical education during that time, was still just blossoming. And we didn't have a whole lot to fall, and rely upon during that first pandemic, not first, but, that pandemic of 1918, the influenza pandemic. And that had really very terrible results because of the lack of information and knowledge then. But since then, scientifically, we have grown so rapidly, and more we've been able to see things accomplished. I mean, just look at this pandemic now. Within less than a year, we see a vaccine be able to be developed and be approved for emergency use. I mean, we've never seen that before. So we've seen this really increase in scientific methods, and how science has been able to really adapt and grow over this last century, since 1918. But I like to just give a little kind of background of that, because this is so important for us if we are to sort facts from fiction during this pandemic. We know, for instance, that Aristotle was one that even before Christ, 384 to 322 BC, was recognized as one of the earliest physicians or health practitioners that really started to think about and put together systematically a method for scientific inquiry in the Western tradition. And he was really focused on observation, on reasoning about the world, and recognized as for his role in that. Many years later, now in the Middle Ages, I just wanted to point out there are many people in between, but I really always admired Isaac Newton for being a Christian, being a man of faith, and how he was so influential as well during that time to really bring together the scientific method. And he became really a revolutionary force during the Enlightenment to really bring people to understand that method of understanding of the natural world, and recognized to this day for his role as well. Now, these were people engaged in many different roles, not just in healing, but there had a very important role in that. But since we are talking about faith community nursing, I also wanted to take a look at what nurses have done. So before Florence Nightingale, even, we had seen that this scientific method of making an observation, asking a question about a disease, a situation, trying to construct a hypothesis, an explanation, if you will, for what was happening, and then trying to test that reasoning, that theory, to explain what would take place, collect data and information about the situation very carefully, analyzing that data very carefully, and then submitting it to methods of statistics and probability to look at the chances that whatever that data was revealing was really true or not true, drawing conclusions, and then communicating results. This is basically, if you will, kind of like a summary of the scientific method. And many people who never studied research or have conducted sometimes have not been as exposed to this in very much detail. As nurses, we do have, all of us, I think, had at least a class in research at some point, so that we could understand a little bit of this. But it was Florence Nightingale, who, by the way, last year we celebrated 200 years of her birth, and who left a legacy in nursing using the scientific method and really bringing nursing to a professional level by using research in this way. And I just wanted to point out, many of you have probably known a lot about Florence Nightingale. She's the founder of modern nursing. She was motivated by her faith to engage in that profession, and really made a huge difference. You might remember in the Crimean War, she already started making difference in regards to how the treatments and covering of the patients then that were coming, the soldiers during the war. And she really was known as the Angel of Mercy, and made a huge difference in regard to the outcomes of patients or the soldiers who she was treating then. And I think it's a wonderful thing to just remember her role, equipping professional nurses and hospitals, writing books about what analysis and research was about, professionalism was about. And she was instrumental to really work in the design of the St. Thomas Hospital. I don't know how many of you had a chance to go to the UK and visit her museum and the St. Thomas Hospital that's still there to this day. First, circa 1173, and then rebuilt in 1872. But until today, it functions. And Florence was one who had made very detailed analysis and observations and contributed to the huge windows, air coming in, separating patients who are infectious from non-infectious, and all these things that she learned starting in the Crimean War, but also beyond then, to be able to contribute to best outcomes for patients. So we come as nurses from that kind of background, really valuing the scientific method and trying to sort what is fact from what is just fiction or anecdote, and really trying to make decisions based on good observations, good data. And so we come from that background into what we know today as evidence-based medicine, if you will, which here's a definition, is the conscientious, explicit, and judicious use of the best evidence we have currently in order to make decisions for the care of our patients, of our, the people that we serve, and also taking into account the practitioner and our roles, our values, our experience in the context of that patient or that one that we are serving, as we identify the best scientific data available that can be helpful for that one. And so evidence-based medicine is the norm for us, and evidence-based information for nursing, for every discipline in health. Now, Florence Nightingale and Ellen White were contemporaries. They probably never met, but both of them had a lasting role for Adventist nurses and for Adventist health ministry, because, as I said, in regards to nursing specifically, we've learned a lot from Florence. And then Ellen White, who was not necessarily a health practitioner, also wrote a lot about health, and God revealed to her, as we believe, many important concepts. And one of the things that Ellen White is very clear, and we even see it in the Bible, is, for instance, the issue related to placebo effect. We know that we have, as it says in Proverbs 23:7, as we think in our heart, so we are. And so there is this very important element that what we think actually has an impact on what happens to us. And Ellen White described this in the book Ministry of Healing 241 by saying that disease sometimes is produced or is often aggravated by our thoughts, by our imagination, and that many are lifelong invalids who might be well if they only thought so. Many imagine that every slight exposure will cause illness, and the evil effect is produced because it is expected. And many die from disease, the cause of which is wholly imaginary. So what Ellen White is kind of relating here and describing here is, in a way, the power of the placebo effect, the power of our minds. And so when we think about the scientific method, we are looking at ways that we can truly evaluate something, a health behavior, health intervention that actually makes a difference beyond even the placebo effect. Because placebo effect is real, is good, can be very helpful in many ways. It's important for us to evaluate how we think, what we believe, and that can have a very positive or negative impact, as Ellen White describes here. But oftentimes in science, we try to see what is effective beyond the placebo effect that we normally have. And so as Adventists, we have an approach to health where first we have this holistic approach, body, mind, and spirit. The soul is important. We have this very clear imperative of the spiritual needs as well as how that affects our health. And in faith community nursing, this is a major role of the intentional care of the spirit. But we also have this idea of focusing on preventive health through lifestyle behaviors and changes, modification, ideally preferable than acute care medicine. But whenever is necessary, we do also engage in acute care medicine, and there's a major role for that, along with surgery and other treatments for conditions that go beyond lifestyle change. And there are some that are in that case. And many times evidence-based is also coming alongside with that. So we have a mandate to educate, to engage in this extending of Jesus healing ministry, focusing on prevention, on oftentimes interventions that can help, and education, but always with a vision of discipleship, of sharing God's love and compassion, meeting people's needs. There might be other elements that also are part of our unique perspective on faith community nursing or on health ministry that perhaps if we could think about, we could discuss. But these are some that come very much in line with what has become our policy in the General Conference Health Ministry. And this is that for everything that we do as professionals, as educators, health promoters, as faith community nurses, we like to minister promoting practices that are in line with the Bible, with the Spirit of Prophecy, the legacy and health counsel that we believe God inspired Ellen White to teach and write upon, and also these evidence-based methods of disease prevention, treatment, and health maintenance. And again, by evidence-based, we are, relating and referring to an accepted body of peer-reviewed, statistically significant evidence that raises the probability of the effectiveness of an intervention or a health behavior to a scientifically convincing level. And so this is actually in our GC, General Conference, working policy for health ministries. And as you know, Faith Community Nursing falls within health ministries, is one of the arms of health ministry. And so all that we engage in should be in line with the Bible, with Spirit of Prophecy, and evidence-based methods. And so it's important for us to then review what is evidence-based and how do we come to really what is described here, body of information that is peer-reviewed, statistically significant, that raises probability of effectiveness. In a pandemic such as the one we're living in right now, this is the area that has been very confusing for people. What is really true? What is really evidence-based? Some doctors even contradict each other. So how can we know? And again, I would like to point out a decision tree that hopefully will be helpful for us. Another element that's also in the health ministry's working policy and that is relevant for us in this is the conflict of interest that is involved. And so individuals sometimes may profit from health information from programs and activities within the church. And so we have to protect such health ministry teaching and activities from conflicts of interest. People trying to sell things, people trying to promote a ministry, sometimes, with an intention that has a self-interest in mind. And so we have to be very careful in what we teach, in what we embrace, so that we are not infringing into this policy. And so be careful with the conflict of interest. And in fact, in our organization, as you saw last year, we voted, I think already, a statement in regards to this, even for the board, which is important. And so this is also real for health ministry in what we teach and in what we educate. So again, 3 essential criteria, and then being able to always, before we engage and teach something for our members, before we promote something, to be able to look at biblical relevance and inspired writings and also scientifically sound information. So with that in mind, I will suggest here a decision tree that we can use to basically test any kind of health information that comes our way during this pandemic, and even beyond that, in what we do for Faith Community Nursing and what we do for health ministries. And the number one question, and I'll give you here 6 questions, and I will give you the handout with this presentation that I am presenting now so that you can refer back to. But basically, let me just see if I can open this here. Yeah, so basically the number one question that we have here that will be helpful for us to cover is, first, is the philosophy and underlying assumptions, or are the philosophy and underlying assumptions of the information we are receiving, whether it is through social media, whether it is, in anywhere we see, or the therapy that we hear about, compatible with, in other words, supportive or neutral, but not antagonistic towards our Christian and biblical worldview. So in other words, is this information I am receiving, is it antagonistic towards the biblical beliefs and what the Bible says, the biblical worldview of whole person health? If it is antagonistic and the answer is yes, this is antagonistic, this is not supportive or neutral in regards to the Bible, because the Bible sometimes doesn't spell out everything. there are principles there, but sometimes there are things that come that we hear about health that were not specifically in the Bible. So they're neutral. They're not antagonistic. They're not in favor. There's just not anything in the Bible that relates specifically to that health information or to that therapy. So as long as it is supportive or neutral, it's fine. That we are okay. We could proceed to the next question. But if it is antagonistic, we stop there. We don't teach it. We don't go forward. So again, in other words, if the answer is yes, it is supportive or neutral in regards to biblical principles, then we can proceed to the next question. But if it is antagonistic, if there's something that is conflicting with the Bible, we will not teach that. We will not embrace that. And we will reject that therapy or the health information. Okay. Now, let's say it is supportive or neutral. So then we will go to the second question in the decision grid. And so in the second question, we see, is the use of this therapy or this information consistent with the inspiring insights and counsel of health given by God, as we believe, to the early Adventist church in the spirit prophecy, especially, but others also. So in addition to the biblical question that we just answered, we go to the second decision grid question, which is it consistent with that that we know about health, the counsel given by God? So again, there are things that are not in the spirit prophecy that, sometimes we may say, well, there's nothing about it, so we don't know. So it's neutral, then that's fine. But if it is not consistent, if it is different than what we hear, then we would stop there. We would not teach that. We would not continue on with that. And we would basically reject that therapy or that health information. So again, if it is consistent, we proceed to the next question. But if it is not, we would reject that therapy or that health information. Now, let me just move something here. So basically, if let's say the information there is in line, it's supportive or it's neutral, there's nothing in the spirit against, this in the spirit prophecy, then we proceed to the next question. This question is very important in the decision grid. Is the use of this therapy or is this health information legal in the state, in the country, or in the jurisdiction in which this is being provided? There are things that may be okay, but may be illegal in the place where we live. And so we have to also consider that. And again, if it is illegal, if it's not okay to do this, then we would reject that and we would, say no to propagating this therapy or even to teaching this. Except, of course, we're talking about health here. And so we have to be careful. Now, if it is okay and legal, then we would proceed. And the fourth question, in case it is legal for us to engage in this, we would go to basically, is there evidence to support the information or the claims that the therapy is effective in treating, let's say in this condition that we are in with pandemic, is it effective in regards to therapy or prevention for COVID-19? And this is one of the most critical and sometimes misunderstood areas of this decision tree. Sometimes it's easy for us to say, oh yeah, it's biblical, it's not. Oh yeah, it's not against spirit prophecy, it's legal, it's not. But when it comes to question number 4, usually it's much easier for people who have studied research, who understand evidence-based treatments and medicine to kind of sort through this a little easier. But even then, there is discussions. So I would like to show to you here, how do we decide if something is effective? And here is then just a bit of a summary of what is evidence-based in regards to some of the studies. And so here we have 4 types, if you will, summarized, of ways to check whether something is evidence, has evidence of effectiveness. One of the strongest methods to evaluate if a therapy, for instance, now during the pandemic, is effective or not, or if wearing masks is good or not for prevention and distancing and all that, has to do with this type of trial. It's called randomized control trial. And in these trials, normally you have randomized sample of people, you compare them with placebo in the case of a treatment, or you compare them to a control group. And then you end up having what is considered the most supportive evidence in regards to a therapy or to health information. One of the issues with this pandemic is that there was very little known. This was a new virus. And so we didn't have any strong experimental supportive evidence to go by. So we had to start from the beginning, all the way from masks to other treatments, other things, from basically the scratch, and then grow the body of evidence. And that's why in the beginning it was confusing. Some people say, oh no, you don't need to wear a mask, it's not good. But then after some studies, they saw, no, actually it is. And from the beginning, Dr. Fauci, you might remember, he would say, this is a lot of unknowns. We are going to go little by little and adapt and change based on what we learn. And we knew, for instance, even from the pandemic in 1918, that distancing worked, that, from previous infectious disease kinds of methods and treatments and interventions, that there was some things that were known based on previous epidemics and things. But with this specific virus, especially in regard to prevention, how the virus would function, how, what would be helpful, what would be not, we didn't know. And so we didn't have this level 1. And that's why there was a lot of confusion in the beginning. We should do this, should do that. People would disagree. And even now, a year after, now we have much better kind of understanding, but still there's a lot of unknowns. And so, but basically, in regards to this decision grid, in regards to evidence-based, strong experimental supportive evidence is usually the strongest evidence we look for. But it's sometimes hard. You need time for this. And you might remember that in the beginning, hydroxychloroquine, some people will say, oh, that's going to be a good treatment. But then it took a while, some trials, they even tried it in many countries. And then finally, they saw there was no good evidence that it helped. It didn't reduce deaths. It didn't reduce the length of the disease. And so now no one is using hydroxychloroquine that I know of. I was in Brazil. There were some places there that they were using it, but really the evidence is much more clear now. It's not good. It doesn't do any good. So we have grown in understanding. So this is the strongest level of that. When we don't have that, do we have the second level, modest observational evidence? What is that? That's usually a cohort, we call it study. It's a group that's studied over time, longitudinally, starting today into the future. For instance, the Adventist Health Study is a type of cohort longitudinal study that is making observations in regards to longevity and health behavior among Adventists. So this is not, the highest level, but it's a strong level of evidence. It's a modest observational evidence that actually makes some comparisons sometimes. And so this is the second level that we look for. And depending on what we find, we will say, okay, this works, this doesn't work, this is likely to be associated with good results or not. Now, there is a weaker level of evidence, the weak descriptive studies. These are usually smaller studies, not a large number of people. There's case studies, something happened to someone. They say, oh, this is what happened to me. I took this medication, I did that, this helped, this didn't help. We call this anecdotal, but these are weak evidence studies. And so if we're gonna recommend something or teach something in regard to therapy or to health behavior, we need to be very careful if we don't have level 1 and 2, and we only have weak descriptive studies. Of course, any health understanding may begin with a case study with anecdotal, descriptions, and that's fine. But then over time, we advance to learn more and more about that thing. So if we have a weak descriptive study, we have to ideally subject that understanding into a clinical trial before we consider adopting that therapy or that health behavior into clinical practice. And as faith community nurses, this is our practice. And so we have to be very careful. And during this pandemic, there was a lot, and there is still a lot of anecdotal or case study kind of, this works here, this works there, this worked for my family, my parents, my whatever, and so people start to share, and that is not necessarily what we want to embrace unless there is stronger evidence. We have to be very careful. Now, when there is nothing, there's no strong experimental studies, there's no observational evidence from a cohort or longitudinal, following up people over the years, and there's no descriptive studies of even smaller groups or case studies even to begin, then we need to be very careful to reject that into clinical practice, because there's no basis that gives us any evidence, or it's really not considered any evidence-based intervention that we can actually use and recommend. And so it's very important that we use the reasoning behind whatever we recommend and we teach to be able to, evaluate what kind of level of evidence we have. We must recommend therapies that are subjected to trials, to studies that can really give us some light into what we need to do. When we don't have that, we need to be very careful. And this is what, let's say, if you don't have any strong evidence, you would stop here and not necessarily teach, even though it may be not against the Bible, not against the spirit of prophecy, but there's no good evidence, particularly now in the pandemic. You have to be careful. Now, early on, we didn't have much evidence and we had to try, and that's fine. There are many things that we had to try by error and see how it goes, and then we study. And so people were dying, so we had to use all methods and start to see, as long as it's not harming the person, we start to see what we could use. But always keeping in mind that there could be harm. Now, let's say if there is good evidence, or at least basic and weak evidence, we would proceed with caution. And then we would come to the next question, number 5, that it is possible that the beneficial effect of applying this therapy or information in our lives would outweigh any negative effects that potentially could come. So is the benefit better than the potential harm? That's always a question we ask. And so if it is potential harm is greater than the benefit, we probably would not do that. And let's say if the benefit is greater than the harm, then we will proceed to the last question. And the last question would be, if we do this, or if we use this therapy, would it prevent us from using something else that would be beneficial in the future? And so sometimes there are therapies, there are things that we do that may prevent us then to use something else because of that use that other intervention may be contraindicated. And so we have to be careful in decision. And this is more for clinicians that really are choosing therapies, but it's good for us as faith community nurses to be aware of this. So if there is not a problem, then we would go and proceed. So in other words, and let me just for a moment here give some time for us to stop sharing here for a minute. So in other words, this decision tree is basically a roadmap for us to evaluate anything that comes to us during this pandemic or beyond. Let's say vaccines. Now vaccines, you're hearing a lot about critical trials and what is recommended, what the scientists are recommending or not. Is it something in the Bible that is against? No, it's not antagonistic to the Christian faith and belief. Is it something and Ellen White speaks against? She never did. In fact, she actually took vaccines. She supported it, gave it to others that worked with her. And so, recommended it. And we as a church believe it should be something that we should recommend, but we don't force anyone. Everybody has the freedom of choice to choose. But if we look at the studies that have been done in the current, options of vaccines, even though we don't have huge information, it's not the latest, longitudinal information in regards to effect. It's enough to show evidence, is enough to show safety that will be helpful at least to prevent further transmission. And so that's why it's being recommended, and then it's something that we can recommend for people based on the studies. This is as an example. Now, same thing with masks, same thing with distancing, and some of the other therapies now during COVID-19. Now, because of misinformation, a lot of things out there, it's helpful to know that the WHO, the CDC, some of these sites that are following all this evidence-based kind of wave of information and studies, they have been putting out clarifications for misinformation. And you can go to the WHO site, there's a major page, Fact from Fiction, and you will see what are the studies and what are the misinformations that are being shared on social media, and they give explanations and clarification. Likewise, the CDC does the same. And so as I know time is running out, and I want some time for us to talk about this and answer some questions. Let me just basically share with you here some also websites that can be helpful for us to go in the church and be able to engage with health information about COVID that hopefully can be helpful for us as well. Let me just go here. We have developed, as I mentioned, I think to many of you early on, a website that gives a lot of health information in regards to COVID that can be helpful. And so I don't know if you are seeing here right now, my screen, let's see.
It's not showing up yet.
Not coming up?
No.
Let me share it here first. Okay. It's probably showing just the general picture right now, right?
It's not coming.
Yeah,
the
for some
website
reason
we
it's
don't
not
see.
sharing.
Is it the
Let me
GP?
try again. Okay, so now I think it will go.
We see your PowerPoint.
Okay, so now can you see here now? You will see this is the website for health ministries. And in this website, we have developed a COVID-19 page. If you go there, you will see this COVID-19 right here. And then when you go to that page, which is, by the way, this is the website, direct website to the COVID-19 page, coronavirus, healthministry.com coronavirus, then you would come to many, links there. And one of the links actually is 3 sets of videos that can be used for health minute in the church or for sharing on social media. There's one that is Facts from Fiction, has several videos. There's another one on mental health, several videos. There's another one on stop transmission that focuses more on lifestyle and various health behaviors that we can have for prevention. So this is just one example of videos that you can actually download if you go to and register on the site as a leader. In this page here, you see leaders, and you click there, you can register to access and download information as a health or faith community nurse or health ministry director. And then that will give you access to videos and more information on the COVID page, as well as other resources on the site, but that you could then link to if you want to use to share and help educate people. Another site, of course, and I'm sure NG probably has mentioned already, is the NAD page on COVID-19 that has a lot of good resources as well that you can use and help sort through things and share helpful information. So basically, and of course, you can also on this site, on our site, subscribe to Health Connection, and we're always sharing. It's a newsletter that we have that's always sharing, new resources or new information, new studies about not just COVID-19, but other relevant topics as well. So you can subscribe it on the website, which is healthministries.com. So as we continue reaching the world and sharing whole, serving all, which is the main goal of all of us engaged in health ministries in the Adventist Church, I guess it's important for us to, again, remember this aspect. We can go and continue serving, but it's important for us to also prepare ourselves and equip ourselves as God teaches us how best to recognize this kind of health related information that can be helpful for us to share with others using a decision tree such as the one that I just shared today. So we have a few minutes. I think it would be good if we could perhaps see if there's some questions that we can talk about. And again, this is mainly principles that we can use to engage and apply to the health information that comes to us. And we are always available to also help you walk through the decision tree as health leaders, both at the division level, the general conference. If you end up having questions and issues that you don't know, what is evidence-based, what is good, what is not. We have constantly been putting out statements that helps to clarify things. We just put out a statement about immunizations, helping to clarify a lot of questions that people had, and it was published both in our website, you will see, also in the Adventist Review, in Adventist News Network. And so this is always good and helpful for you to keep engaged with what's going on the health ministry's websites, and that can help you as well. So I don't know if there is any questions before we close with the prayer.
As you're thinking of your questions, feel free to put it in the chat, or you can unmute yourself and ask the question as well. And just so you know, I've also been adding the links that Katia has mentioned in her presentation to this webinar recording, so you'll get all of those linked there as well. But yes, please go ahead. We'd love to open up some time for questions.
This isn't a question, but it's a comment. Your presentation was very good, and I'm so glad to know about the resources at the end. And I'm going to look at those videos because I think they would be good, like for a health nugget at church on the coronavirus.
That's exactly right. Yeah, that's part of what we were thinking, John, when we created it. It's short. It's usually a minute or less, so that it can be shared on a health minute in the church or social media. Which has been a way that a lot of people have been sharing information nowadays.
And we're having a health ministry meeting next week, so I'm going to mention about these health videos.
Excellent. Thank you, John.
We have a question in the chat.
I don't see.
Yeah, I see here.
You didn't post it. It's not there. I don't see it.
Sorry, Linda.
Yeah, let me ask, shall I answer the question from Teresa first? She says, do the videos address best practices for treatment when a person is diagnosed with COVID? Some of the videos we're talking mainly about prevention, not necessarily prescribing treatment, because again, treatment has to be best addressed by a healthcare professional who knows the patient, who understands, the background, the history. And so we were not giving any specifics on diagnosis or treatment in those videos. The videos pretty much help to in one way, explain certain things, another way, sort myth from fact, like the first sets of videos. We list some of the myths and then clarify it. And the other one just talks about evidence-based information for prevention, or, that can help slow the transmission. And the question here, can Katia tell us again how to get to the health ministry videos? So again, let me just share with you here. If you go to the healthministries.com website /coronavirus, which is this website right here, healthministries.com/coronavirus, you will come to the videos at the bottom. There's many videos, various things, various resources, and you will see these 3 sets of videos. And in order, you can watch it on the page, but in order to be able to access and download, you need to be registered on the site as a leader. And to do that, you go to AdventistHealthMinistries.com, and then you go here under leaders, click leaders, and then register as a faith community nurse at a such church. And then that gives you access. So then when you go to the COVID-19 page, you will see that there's some resources there that are downloadable, including the videos from Vimeo that you can download. Okay.
Question,
Somebody's saying, I don't find that page. Which page that you are not finding, Anne? Anne? I don't know which page is it that you're not finding. The one with the 3 videos is the COVID page. So healthministries.com/coronavirus, or you can click on COVID-19. And then let me see here if I can go on the website directly to show you if it's helpful. So let me find it here, COVID-19. So let me see if I can share this with you. Okay, so do you see here the coronavirus page? Right, this is the coronavirus page. So when you come to the bottom, because there's a lot of explanation about, you know, various questions and issues, then you come to the videos. Do you see here? So here you can see the videos, and you know, you can click to watch the set of videos, or you can, you know, if you register, you can download it. Okay. Yes, in order to download, you need to register, but you don't need to register to see the videos. Okay. Now somebody asked, where is the working policies that you discussed located? Oh, those working policies are Health Ministries working policies. I'm sure that Angie probably has copies of that and can share, or we can share with you. It's not listed on for the public per se, but these are in a book, in a GC policy book for the global church. And we are happy to share with you if that's helpful. Angie, I don't know, what do you think? Do you have copies of that?
I don't have the you know, printable copies, but I do have the book itself. But those are the working policy documents are usually restricted to internal access.
Yeah, but we are happy to share with health ministry leaders and people who work in health ministry this piece that explains about evidence-based and all that. And if you wish, I'm happy to provide a link that can be shared electronically with the AAFCN members here, if you wish.
Maybe Katia, you could send it to me and I'll put it on the website along with the recording of this video. So they have the context for it.
Excellent. All right. Okay. Any other questions? Not?
Like,
I don't know, Teresa had asked me to pray, but maybe Angie, do you have other plans at the end? I don't know.
Oh no, well, let's go ahead with the plan you discussed. We'd love to have you pray to close us out, and thank you all again for being with us. Just one quick reminder that I forgot to mention earlier. We do plan to have an InTouch session for February, but for March and April, we will not be having InTouch because we will be having the Foundations of Faith Community Nursing course. So please keep that in mind. You can check our website for the schedule. You can reach out to any one of the leaders to find out from us. But thank you again so much, Katia, for being with us and for sharing all this great information, and also a way to evaluate, you know, what we see and what we hear. That's really very important. And of course, you know, another key aspect is the conscience of the believers, that we can share with each other, press together, talk to each other. Let's work this out together, because that was part of the process of how our early church founders came to our beliefs. Is they came together, they prayed over it, they studied hard, and when they needed to step away from each other and study on their own, they did, but they came back together and they wanted to be in unity. So that can be our prayer also, even with these conversations that really, the devil is trying to use to split us apart. So let's rest in Jesus to bring us together over these issues. So thank you again so much, Katia. This has been incredible. And please, thank you for your prayer now.
Sure. And again, thank you for the opportunity to share. And I'll be sending you also the handout of the presentation, Angie, that might be helpful to add so people can see the tree, the questions and use. And as Angie was saying, any time that you come into situations that you have questions and you don't know, just bring it, and maybe there can be good discussion. And that's why we're here to help to facilitate the thinking and the processes to help educate our members and our church with the best possible information that will bring the best possible outcome. And always seeking God's wisdom, because sometimes there are many unknowns, and He can guide us through that process as well. Shall we pray and ask His blessing? Father, we are still living through such a horrific time of this pandemic, with so many people getting sick and many dying, many losing loved ones. And Lord, we want to be agents of healing, agents that can help share information that will be helpful to people. And as we just discussed today, you have provided for us a good strategy, a good way of thinking through the much sometimes ill-used efforts to bring misinformation to people. And we want to be able to walk that process with wisdom, helping to educate pleasantly and intelligent, as you have asked us to do, in a way that can be helpful. So guide our thoughts, guide our evaluation and our analysis before we share things and before we teach others, so that we can talk together and seek counsel as we try to do our best to provide reliable health information during this time. Give us wisdom, help us to be open to your Holy Spirit's impression in our hearts, and give us discernment, Lord. Help us to be able to read more and learn more and keep up with as much information as we can, so we can be better prepared and equipped to be agents of healing during this time. Bless each one that's in this meeting, and we give ourselves to you, surrendering all the things that we are carrying, so that we can be true vessels in your hands. So use us for your glory is our prayer, in Jesus' name. Amen.